Gee. Women probably should be up in arms right now. Or are you hearing more from women?
We are. I think that the image that a lot of us had from some of the town halls this summer were of angry men waving their fists in the air about health care reform. And frankly, we think that the time is now for women to come out and say enough is enough. We need to get this done. Women and their families cannot wait any longer for health care reform that will enable women and their families to get good, quality, affordable health coverage.
And do women get charged more?
They do, and thank you for bringing that up. In 40 states around the country, it is legal for health insurance companies to charge men and women different premiums just based on sex alone. And when we did a study last year looking at this practice, we thought that you would think that insurance companies that do engage in this practice, it's called gender rating, that it would tend to cluster around a certain amount, that men and women would be charged pretty much the same differential from policy to policy. And we found wide variations in this practice. And in fact, when we first did our study, we found one insurance company in Missouri that was charging women 140% more than a same-aged man for the same exact insurance policy. This kind of arbitrary gender rating was happening all over the country, and we thought to ourselves as researchers, well, it has to be because these policies include maternity care. And in fact, we looked to see, and most of the policies don't include maternity care, so it's not even that you can look to maternity coverage as a justification for charging these different premiums.
Well, if women, there are jobs where there are a lot more women than men hired. In companies like that, does it cost more to get the insurance?
It does. Gender rating is not a phenomenon unique to the individual market. It also has an impact on employer-sponsored coverage. When employers try to get insurance coverage for their employees, they also have to go through a process where the characteristics of the employees help the insurance company decide what premiums to charge. So employers that have a majority female workforce could face higher premiums simply because that employer has more women in their workforce. So we're particularly concerned about employers that tend to have predominantly female workforces like child care providers and home care providers that will be faced with higher health care costs simply because they hire and employ more women than men. This is a problem also for premiums that are based on age and as well as health status, something that we are definitely hoping will change in health care reform legislation.
So age, I suppose that if it's childbearing age, does it automatically cost more, or do they routinely not cover maternity unless
they routinely do not cover maternity in these policies, but it doesn't stop them from charging women more for these policies. What we found was that insurance companies tended to charge women more than men until around age 55. And then some, but not all of the insurance companies charged men more than women for the same coverage.
That is no explanation.
No. They say they blame it on what's called actuarial statistics, which are statistics that they say helps them decide how much to charge premiums based on. They say it's because women use the healthcare system more than men. We say that this kind of treatment just continues to serve as a barrier for women, and frankly, even if it was based on these statistics, there's no way to explain the wild variation in differences that women and men were charged for these policies all over the country.
So if a young woman has health insurance but not a maternity added to that basic policy, if she should then become pregnant, what is the liability?
It can be considerable. We know that in 2006, the average cost of an uncomplicated vaginal delivery was $7,500. I'm sure you and your viewers know many women who have had deliveries that were more complicated and can certainly cost much more than that. There's a reporter actually who wrote about her experiences with her health insurance policy when she found out that her maternity wasn't covered for her, and it cost her $22,000 for the cesarean section she had and the complications following the procedure.
Mm-hmm. So in some situations, it doesn't help at all to have insurance. I mean, even if you have it, you're paying it, but it doesn't cover always where you need it.
That's right, and that's what we call being underinsured, or having a health insurance policy that still leaves you at great financial risk should you find that you have to use it. There are a number of health insurance policies that we say are in name only, where you have a policy, but you could end up spending, most policy experts agree, if you're spending more than 10% of your income on health care costs, that you are underinsured. And many families face those challenges with these kind of bare bones health plans, where families are left with very high deductibles, meaning they have to spend several $1,000s out of their own pockets before any insurance coverage kicks in at all. And that's just not, it's not a tenable situation for many families, and it's a leading reason why we know that women and families are declaring bankruptcy. The largest reason why is because of medical debt.
I just imagine that if having a baby through cesarean would cost you $20-some thousand, then for the average working woman in this country, that would lend itself to bankruptcy.
Absolutely, absolutely. It's an untenable situation. You know, I think the other thing that struck us in looking at these policies that didn't include maternity was that some people who say that you shouldn't have to mandate that maternity be covered as a basic health needed health service, they say, well, it's a lifestyle choice. But if you think that more than half of all pregnancies in this country are unplanned, when you're buying that insurance, you may not be thinking whether or not you need that maternity until you do. And then you're looking at a significant financial hit to your family when you get pregnant and you don't have that coverage.
If you get pregnant and look at your policy and find that that is not covered, when you ask for the coverage, do they ever say anything about pre-existing condition?
Well, in most cases, pregnancy is considered a pre-existing condition, meaning that if you are already pregnant when you get that policy, if they'll even sell you a policy, a lot of insurance companies won't even sell you a policy at that point. If you are lucky enough to get any health insurance, they will deem it a pre-existing condition, and they would not cover any issue related to that pregnancy.
Well, women are really at risk in this country if they get sick.
Absolutely. Something needs to change, and quickly.
Well, I hope we can. I am one of the people that really want to see it change. I am by education a nurse. I haven't practiced in a long time, but much of this was going on when I was practicing. It's just gotten worse. And it's gotten worse, less coverage, and costing more. I just do not understand how insurance companies could justify that.
Yeah, it's really hard to understand, given what we know is such a problem out there for so many families. That there are some who would still oppose efforts to change our healthcare system and make healthcare more affordable and accessible for people. That women and their families face these kinds of challenges on a daily basis, these kinds of outrages, is just unacceptable.
So what it really means is that if your gender determines whether